Hi, it's live. Ted Koren here, and I'm really close to the router. So if we lose connection this time, I mean, the next place I'll have to be is inside the router. So here we go. I'm by the fireplace, by the way, and by our beautiful red wall. And cool. So I want to talk about pain and low back pain and carpal tunnel and other things like that, and KST, Koren specific technique. One of the things I've always discovered, and which I think is a real problem in much healing, is that people want to get rid of pain for the sake of getting rid of pain. As it's been said, that's like destroying the fire alarm because it's keeping you up at night. You want to get to the cause. And a lot of people that have low back pain or other pains really have, the problem is not necessarily in the back. There have been some writers that say a lot of low back problems are due to built up stress, physical and emotional. I think Sarno was one of them, a New York surgeon or medical doctor who helped people getting rid of lots of low back pain by having them do a lot of non-surgical things. And KST falls into that category, of course. But you might be surprised to find out that where the problem is not necessarily where the pain is. I remember one story from a KST doctor. I've had many, who said, well, he got this patient in, she was a dancer, and she was performing professionally, and she couldn't work. She couldn't work because she was in horrible hip pain. Let me move this a little bit. That doesn't work. There we go. No, we don't. I know. This is the first time I'm doing this here. Please forgive me. Here we go. That's even a little better. Although it looks like a tree is coming out of my head. Anyway, horrible hip pain, horrible back pain, couldn't work. She'd been to 5 or 6 other doctors, chiropractors, orthopedists, physical therapists, acupuncture, massage, body work, nothing helped. They all worked where the pain was. She had pain in her hip and leg and back, and that's where they worked and massaged and needled and did all the kind of things that they did. Still in horrible pain, still couldn't function. With KST, we ask the body. And I can do a whole talk on asking the body. If you're interested, write to me and let me know. I can also talk about other subjects such as vaccination, which is a hot topic now, bizarrely so. And I'll explain why bizarre at a future time. But if you're interested in it, let me know. I can do a talk on that as well. So anyway, she had a horrible pain. She comes in, she heard he does something different, and he did what a KST doctor does, and that's ask the body. Don't just go where the pain is. Find out what the body is trying to do. And asking the body, it turns out her collarbone needed to be corrected. So he used the arthrosome instrument, tapped her collarbone in the proper direction, and he said, okay, start walking. And she did. Hip pain totally gone. That's not supposed to happen. But we find connections where most people don't. And that's one of the beauties of KST, looking for connections. And the body is smarter than we are. We have different professions: chiropractor, osteopathy, medical doctor, naturopathy, physical therapy, craniosacral therapy, massage, bodywork. They're all great, but that tends to put people into a category, in a box. And the most important thing is that the body is not in a category or a box. And we have to respect everything the body wants done. So I had a patient in not too long ago, chronic sciatica. She's had it for years. Checked her. Where did I correct her? Elbow. No, I kid you not. Tapped her elbow in the direction the body wanted. The second I tapped it, she said, sciatica has gone. Totally disappeared. And it's been quite a while now, has never come back. Why? We don't know. We have to bring back into healing that things are mysterious. The body has mysteries. If you follow the body, humble yourself before the wisdom of the body, you learn a whole lot of things. So, and you'll help people to a much greater degree, no matter what your specialty or field. And I'll be talking about that at our upcoming KST seminars, Koren specific technique seminars. We're having one in Columbia, South Carolina, and then in Taiwan, and then in Sweden, as well as places in the US. So anyway, skull. This is a skull. And as you can see, there's different colors. It's not the way it is in real life. If you open somebody, their skull is not green and purple. But this is the skull. It's made up of many different bones. This is just a model. In fact, in real life, no one has a skull that looks like this. Everyone's skull is unique, and every patient is unique structurally. Their internal organs are different. The body chemistry is different. Their history, emotional, is obvious. People are unique. And when we look at models, skull, or theoretical models on healing, we have to not take these models as the ultimate, but just as a suggestion. So we have a skull here, and sometimes when we do KST, someone with severe low back pain, sciatica, arm pain, shoulder pain, it doesn't really matter, but you get people with pain a lot. Pain is a great motivator. That's what got me to discover this work. So we would actually find that the most important thing was working on the skull. You would, and the skull bone, healing, cranial osteopathy, cranial chiropractic, cranial work is really ancient, and it's been forgotten. We're bringing it back. Thank God, it's needed. And sometimes just correcting one cranial bone will get rid of sciatica, low back pain. Happened to me. Sometimes leg pain, correct a cranial bone, and the pain disappears. And you think of people that are getting worked on where the pain is, and it's understandable, but that's not necessarily where the cause is. And this is really important. In addition to the skull, we have the upper cervical spine. Now, in chiropractic and other fields, some other fields, these two bones, by the way, that's the upper cervical, upper neck, right below the skull. And in the upper neck, the skull sits on top of this. So theoretically, this would be a very bizarre shaped person, it'd be something like this, where the skull, and then you have the bone, these bones underneath that's sort of enlarged. So I can show you. This is the Atlas. It's a big brain. Just like Atlas, the Greek god who held the earth on his shoulders. So your Atlas vertebra, this is the spinal bone, your Atlas vertebra holds the globe of the earth on its shoulders, on its joints. And underneath is the axis, and there are others. Well, we've often found that correcting the Atlas will get rid of low back pain, or carpal tunnel, or depression, anxiety, migraines, vision problems, hearing problems, asthma. You can't really separate the body into parts. So when you ask the body, what does it want done? In addition to often the cranials need being corrected, you get upper cervical areas. And the upper cervical area may include correcting the purple bone, which sits on top, and that is the occipital bone. So when you start doing KST, and I teach loads of people this work, you might find that the body will send you to different places. In addition to that, we have here, I have a model of the skull, of the spine. Here's the skull up here, and here's the hips. And these two bones actually are the first two here, but sure really can't see them. I like to use visual aids on occasion. When I was doing a lot of TV, I noticed that they would always shift. You're a guest on TV, and they've got 3 cameras, maybe more, and the cameras are all lighting up, bing, bing, which tells you which one is live. There's a director usually in a booth somewhere, pressing buttons. Okay, shoot at this angle, this angle, this angle, move this camera this way, move it that way. And it was constantly distracting everybody. They believe that if you look at an image more than 7 seconds at a time, then you'll get bored and change channels, I guess. So I would bring along a model spine and say, look at this. And the host and the director had no choice but to have that camera on the spine so they're not driving everybody crazy with camera angles. So that's what I'm doing here. Sorry for the digression. So you have the vertebra. We find that clinically, sometimes T1, the upper back vertebra, right below the neck, are twisted. Very common with carpal tunnel. Low back pain, the sciatica, the lower lumbars are out of place. And sometimes the discs need work. Yes, you can work precisely on the discs. This is like disc surgery without surgery. just working on discs alone. Now, when we find people have disc issues, then we also find in many cases they're dehydrated. Because when a person is chronically dehydrated, their discs flatten out. Okay, that's the stuff between the bones, flatten out, and it can actually cause pressure on nerves or irritation to the area or inflammation. I've actually had people get rid of severe chronic low back problems by drinking more water. A few days or a week later, and suddenly they're not in such horrible agony, because dehydrated people can have serious health problems. So anyway, when I've worked on people with disc problems, you can actually tap on the body, on the back, to affect the discs. There's a long word for that. It's called myofascial drillosis. And it actually means that fibers seem to come out of the disc and sort of spread through the back to stabilize the disc. When you work on those fibers gently, it's not a big painful thing, you can actually bring the disc back in place. How does it exactly work? Nobody really knows, but it works. It works really well. This myofascial drillosis was discovered actually in Europe in the 1920s and it was brought over to America by Janet Travell, who's a medical doctor, physiatrist. Clinically, it was used without knowing about Janet Travell's work, was independently discovered by a chiropractor named Richard Van Rump, who developed directional non-force technique, DNFT, which was an inspiration for KST. And he acknowledged that it's weird, but you find fibers on the back and you work on those fibers and the disc problem clears up. Sciatica goes away. Leg pain goes away. Back pain goes away. Surgery goes away. You don't need surgery. And of course, I'm always reminded of Robert Mendelsohn, medical doctor, the pediatrician. He testified in the trial against the AMA for the AMA tried to destroy chiropractic, but that shouldn't surprise anyone in this trial because they've tried to destroy every competitor: homeopathy, naturopathy, osteopathy, optometry. The AMA has a great habit of not being nice and not making friends, and instead trying to destroy its enemies. And it's still around. I hate to say it, but we still have elements of that in medicine. Just try to have a discussion about vaccination. You'll see how illogical people get. But enough of that. So what would happen is you can actually work on the disc, and it'll go back in place. No need for surgery. And as I said, Van Rump discovered this in the 1920s, and Robert Mendelsohn, the medical doctor who spoke at the Wilk trial, in which the AMA lost a tremendous amount, hopefully of prestige, because they've been behaving very poorly. He acknowledged that he would never refer anyone to back surgery unless they'd first been to a chiropractor. I would recommend especially a KST chiropractor because we get the results so quickly. And there's no cracking or twisting, or popping or distraction with KST. It's gentle, not only on the patient, but it's gentle on the doctor. A lot of doctors, sadly, have to stop practicing from years of manual work, helping people, but manually. It's rough on their bodies. And I know 7 chiropractors in my general area that have had surgery from years of, structural work, manual work. It's rough on the doctor. Any profession that does the same thing over and over again, it's rough on them. Dentists, I take care of a lot of dentists. They have carpal tunnel and neck and back problems from bending on people and being in a certain position all the time. Surgeons, hairdressers, anyone who does things in a certain position over and over again will ultimately have micro traumas causing macro traumas, little injuries in time resulting in big injuries. And we see this a lot. So whenever you work on someone, I tell this to KST doctors, and I tell this to any healer that comes to my seminars, is that don't assume that where the pain is where the problem is. That is a very bad assumption. And actually one orthopedic surgeon, I forget who, but he said, he who goes after pain is lost. You go after the cause. And in some cases, it's the cranium. Low back pain, sciatica, disc problems, carpal tunnel, the skull is slightly off. Which bone? Well, sometimes it's the occiput, sometimes it's the yellow bone here, the sphenoid. It could be others, it could be a combination or more. Sometimes the upper cervical spine is out. Could be the right below the skull, the atlas vertebra could be rotated or jammed up in some way in various directions. With KST, we acknowledge something. We've discovered it on our own. Later, I found out it was called the Blair listing, which is how a particular vertebra appears to go out of position, pressing on the spinal cord and various nerves. Now I've been studying more Chinese medicine, and it seems that the way the correction perfectly coincides with urinary bladder and gallbladder meridian points that correspond exactly to this, which is sort of neat. I like that. A lot of times you may find you have to work on the low back, but if you might find the person is dehydrated. And the real key to get rid of their disc problems and low back pain might be just drinking more water. In addition, probably there's some structural work that can be done. I've also worked on people with carpal tunnel. Carpal tunnel is often right below the neck, the upper thoracic area, which feeds or creates the nerves that go to the arms, shoulders, hands, upper extremities. But in addition, there's something called double crush, meaning it's not just the spine that has nerve impingement or nerve interference or nerve pressure. Lots of other terms are used too. It could be the shoulder, could be the elbow, could be the wrist, could be the hand, could be the cranial bones, could be the low back. We have to stop looking at the body, what's the term, linearly. I might find that a person with chronic sciatica has emotional issues that are causing it. You cannot put people in a box. Not everybody is structural. Not everybody is structural. Not everybody is emotional. Not everybody is spiritual. Not everybody has the same toxins or history. You have to really, with KST, we respect the body. We just say, what does the body want now? It opens up a whole world of healing. And with KST, of course, we have a flow chart, which is really a way of reminding you how to ask questions. Lots of questions you can ask. So we sort of organize it so each time you see a patient, you're not lost. You know how to start going through a nice flow chart, which had to zero in on part of the body that could be affected. It could be toxicity. It could be a dental problem. No kidding. A bad root canal, and they all eventually go bad, can cause sciatica or digestive problems or tumors. And the research, or MS, Parkinson's, it's all in the research. So you have to keep an open mind. What I try to do when I teach is remind people of all the places they can look. So when people say to me, what is KST, Koren specific technique? I say, we locate the stresses everybody else misses. We locate the hidden stresses, stress that you might have had since you were a child. And you get better at KST when you just ask more questions. You get comfortable with asking lots of questions. So I don't care what your health background is as a professional or a lay person. The more you do KST, the more comfortable you get asking questions. And and of course, every healer talks about the wisdom of the body. Well, most every healer. And with KST, our goal is to follow the wisdom of the body, to ask, what does the body want now? And at KST seminars, I do demos. And when I speak at state associations and schools and what have you, I'll do demos. I'll bring somebody on stage and we'll discuss what kinds of things. That's how I discovered the dyslexia protocol. Because one of the cool things about KST is that you can put a person in a different posture and find different areas of stress, subluxation, damage, blockage, interference when they're in a different posture. In one posture, they're fine. Another posture, they're a mess. So you can work on somebody when they're laying face down. I don't care if they have neck ache, backache, headaches, sciatica, it doesn't matter. And you clear them out. But they had their whiplash, for example, when they were sitting. Second, they get in the car and they're sitting, problems come back. So what do? You check and correct them when they're sitting. And I've done that many times where I'll have a person who was in a car accident sit and put their hands on an imaginary steering wheel and their foot on an imaginary brake and actually mentally be in the mental posture of seeing the accident happen. So you have a physical posture and a mental posture. All kinds of things surface and reveal, and you correct them. That is what gets people truly better, acknowledging not only the uniqueness of every person, but their unique and different postures and positions. And you can correct them for physical and emotional stuff. As I said a moment ago, this is how the dyslexia pattern was discovered when a doctor asked from the audience, can you put a person in a posture where they're having trouble reading? And I said, I guess. And he came on stage because he was the one who had trouble reading. And as I corrected everything, he was clear, nothing out. I gave him a book to read and everything locked up. So you work on the person while they're reading. And I remember he started crying. Suddenly he could read. First time since he could remember. And this was not a young kid. This was a person, I think it was in his 50s or 60s. He had never been able to read without struggle and pressure and problems. Finally he could. Only because we put him in a posture of reading or writing or dyspraxia or dyscalculia, math problems, or any other posture. Sometimes it's a combination of physical posture and emotional posture. In fact, that's very common because every time you change your physical body, your movement, and your thoughts, you will often change hundreds of things in your body. So anyway, that's what KST is about. I talked a little bit about pain and got into a few digressions on other subjects, but it's a fascinating topic. And if you want me to talk about other subjects, other things, other conditions, anything to do with health and healing, including nutrition, vaccination, allergies, please write to me and let me know. I'll be happy to discuss it at future Facebook Live. And I'll even do more of these if there's enough interest. So I hope to see you coming up in South Carolina, Sweden, Taiwan. I will be speaking in English. We will have translators. And of course in the US. So please get back to me, write to me, sign up for a seminar, experience the best care of your life. So thank you, and hopefully I'll see you again soon.